Hello, everyone, and welcome to another edition of Health Matters, the community access program for the Worcester District Medical Society here at WCCA TV in Worcester. I'm your host, Dr. Michael Hirsh. Happy to be here with two wonderful guests that are going to be describing a very new and exciting program that's going to be our own version of vaccination against childhood injury. And why would we care about this topic? Well, injury is the number one killer of children under the age of 19. And so prevention, which we feel is appropriate in about 95% of the cases that we see in the trauma room in our hospital at UMass Medical Center, is the best medicine because after the fact, it's a lot harder to keep the kids well, but if we can prevent those injuries, wow. So here we have as our guests two wonderful representatives of the MAPFRE Insurance Company and MAPFRE Foundation. We have Linda Johnson, who is the Assistant Vice President for Social Responsibility, and Steve Shiner, who's the Senior Vice President for Operations for MAPFRE. And we're going to tell you a story over the next half hour about how we developed a new injury prevention program that has wheels and will come right to your child's school, and it's called Safety Quest. So I guess the first question I would ask Linda, because I know how involved you've been in the development of this process, is where did this all start?
Thank you, Dr. Hirsh. It was really exciting. I had the opportunity to meet with Catherine Driscoll, who's your Chief Philanthropy Officer, and we were exploring and dialoguing around our foundation and UMass Memorial and what programs you have. And for the foundation, one of our major areas that we focus on is road safety and injury prevention. And she happened to mention that a program that you had previously with the Worcester Public School Systems for injury prevention, that there was an issue with the van that was destroyed and that the program had stopped. And then as we talked further, it became apparent to us that we may have an opportunity to partner and collaborate to create a new injury prevention program. So that led us to meeting you, Dr. Hirsh, which was wonderful. And we had the opportunity to put a team together from the foundation, MAPFRE Insurance, and UMass Memorial to actually create the Safety Quest program.
Yes, and hopefully as you're sitting in the audience, folks, you're seeing some images of Safety Quest, which actually is being kind of rolled out gradually. I would call it beta testing. Maybe that's a word from the 80s and 90s, but we have gotten very good feedback about the program. And the program that Ms. Johnson was referring to that kind of had gotten damaged in the winter of 2018 was called Mobile Safety Street. And that was a very successful program. It was running for 10 years through not only the Worcester Public Schools, but other regional schools here in central Massachusetts. But it was very hands-on. It had, kind of a mock-up of a house and a mock-up of street situations. It had a minibus that was pulling a trailer. And so it was very bulky, very labor-intensive. And the amazing thing is when we first met, how immediately MAPFRE came up with the thing that's so 90s, So now we're going into the world of virtual reality as a way of educating children. And that's really where we went. And the team that Linda helped put together included an educator that we had retained during the time of creating Mobile Safety Street so that we could be true to the curriculum. And we involved the Worcester Public Schools and we involved a lot of partners. And the final product, I think, is pretty spectacular. I mean, would you want to tell us a little bit of what you think the highlights of this vehicle is?
I would be so excited to tell you about what we built. Actually, it's really cool. The curriculum for injury prevention really is targeting grade 5. and the students that are in the Worcester Public School systems and also surrounding towns. We will have the opportunity where students will enter into the RV, and the first thing they'll see is a video. And one of the characters is called Z, and Z has a safety squad. And what the safety squad does, it is entice the children to be able to listen and sign up to be safety squad injury prevention, folks that really want to learn about injury prevention. There are 3 stations within the RV that focus on injury prevention. One is called Street Smart, the other is called Home Hazard Hut, and the last one is called Escape Artist. The Escape Artist focuses on educating around fire. How do you escape from your home? And what kind of plan do children have with their parents to know how to get out of a house if there is a fire? And the video tablet helps them walk through understanding safe behaviors, and at the end it tests them on what their escape plan would be. The home hazard hunt actually helps them to think about various areas in the house, the kitchen, the bathroom, and outside, by the pool, in a playground, and things. What do you need to be aware of that might be an object or an obstacle for safety to prevent injury? And once again, when they find those obstacles, they get points for finding the obstacles. And the last one is also Street Smarts, where they're out by outside. And then they hook up with a character on a tablet, and the character walks them through obstacles once again to be aware of as a pedestrian or on a bike. And once again, they get points. And at the end of the 3 stations, as they walk out, Z greets them in a video again and says, squat up and be safe and watch out for those injury prevention obstacles. So it's very exciting. The team from UMass that actually facilitates the games are wonderful, Asia, Leah, and Dominic, and we appreciate all that they do in engaging the grade 5 students on those mobile experiences. Very interactive, tablet-driven, and video-driven.
Wow, it really sounds even more exciting than I remember from just seeing some of the prototypes. So I'm going to be very excited. I'm going to be seeing it roll out in a week or so for real. And so far the feedback has been really great. We were able to walk through it with some of the folks from the MAPFRE Foundation that came out from Spain, where your base is, and they seem to be very thrilled
Very
about
excited about it.
We picked the 5th grade for a number of reasons. One is that it's the year that the MCAS exam is not given, so that this curriculum for 5th graders doesn't take away from any study time, and we can, alleviate any concerns that parents might have. Is this frill or extra? No, it actually replaces the health curriculum that they would have to learn inside. And the great thing is, from our previous knowledge about Mobile Safety Street, these kind of programs improve the students' understanding of the curriculum much better than having it in a classroom. And their retention of this has been much better, at least in a previous iteration, in the Mobile Safety Street iteration. But we're going to test that again, and we're going to be doing pre-tests and follow-up tests, and then long-term retention contacts to the students as they go through. So we'll hopefully have information that will either help us adjust the curriculum or just know that we're on the right track. So very excited about that. So I guess turning to you, Steve, MAPFRE is a billion-dollar corporation. You are obviously in the insurance business, where you would like to avoid injury because you have to pay out for injuries. I understand that. But your corporation has, dived into this in a way that most corporations don't. And can you explain that? What's the overarching philosophy of MAPFRE that makes it different?
I'd be happy to. And first of all, thank you for having us, Dr. Hirsh. We at MAPFRE are very proud of the MAPFRE Foundation. This is the part of our corporation that's separate from our insurance business, that was established in 1975. and it's active in 27 countries. And keep me honest, Linda,
I will.
this is what Linda knows best. But it really, the vision of the Mafre Foundation is improving the quality of life of people around the world through a variety of different initiatives. In the United States, the focus is largely on injury prevention and road safety, as well as social intervention and insurance and social protection. So that's our core focus area. Like you said, we see a lot of injuries, injuries that are a consequence of risky driving, bad decisions, and Mafre, as an insurer, has a unique perspective of seeing that, and that's one of the reasons that the foundation has invested in, accident prevention and injury prevention, and we partner with a number of organizations to advance our goals. Obviously, UMass Medical Center is one of them. But also Best Buddies. Best Buddies helps young people prepare for employment and giving them the tools that they need to be employed successfully. In fact, we at Mafre have had many interns from Best Buddies working in different areas within the company, and security and the contact center and facilities. And they are wonderful people, and they bring an enthusiasm to work that our leaders really enjoy. We also partner with the United Way of South Central Massachusetts, the Real Madrid Foundation, One Goal, which
yes.
is a really exciting program that helps young people in the senior year of high school that are in disadvantaged communities prepare for college. They're assigned a teacher that works very closely with them to go through the application process, set up college visits, and it continues right into that first couple of years of college, helping them understand how to be successful academically as well as socially, so that they get to that end point and graduate. So there are several other partners that we work with. We contribute or fund about $1.4 million annually with these programs, and we touch about 71,000 people every year through the various programs that we have in place.
Yeah, very exciting. One additional partner that I would talk about is we do partner with Mothers Against Drunk Driving as well. And this year with Mothers Against Drunk Driving, they announced a program called The Power of Me. And what's interesting is that program is specifically for grade 5 students that are helping those students understand the distractions and the things to be aware of in grade 5. That when I was speaking with some of the folks from Mothers Against Drunk Driving, they felt that even though their programs focus on adults and teens, that they were finding they needed to go a little bit earlier in the youth to be able to help educate them and make them aware of distractions and what that does.
Yeah, this is an amazing track record that Mafre has, and we couldn't have found a better partner in the injury prevention program at UMass. We just got statistics from the state that showed that pedestrian injuries and motor vehicle crash injuries were way up over the last 2 years here in the Commonwealth. I think a lot of that is a post-pandemic effect. I think people were not driving as much. There was less traffic. Now the traffic volume has returned to pre-pandemic levels. But what hasn't returned potentially is people's awareness of what that volume needs, either as a driver or as a pedestrian. And we're having a lot of pedestrian-related injuries because the kids are actually on their phones while they're walking. They're not paying attention to the crosswalks. They're not, even though the lights should be the be-all and the end-all. There are so many instances where a driver is sitting at a red light and decides it's time to catch up on his texts. Then the light changes. There's a honk from the people behind them to tell them, get going. And they don't even look. They just hit the gas. And there can be a kid right in the crosswalk in front of them. So we're trying to drill down on our stats within the trauma center to see if there's any overarching sense that we can make of that. And I'm also working with Worcester City has a new subsection of the Department of Public Works that's responsible now for transportation and mobility. And there are several pedestrian and motor vehicle hotspots that have been the cause of not just kiddie injuries, but our medical students who are traveling between our several campuses. There are some places where when they try to get into the stream of traffic or make a move to get into one of our garages, that making a left or making a right on some of these streets is just about impossible. So I think that this program is going to make the fifth graders very aware of the responsibility they have when they're trying to get to point A to point B. So we love that. And what we also learned from the community the first time we chose the fifth grade, many of these fifth graders are walking their little second and third grader siblings to school. And so they're not just walking for themselves, they're walking for their family. And I think this is going to be a great infusion of education for them,
Yeah, one of the things we're proud of is partnering with UMass and having the ability for Safety Quest to travel the Worcester public school systems. And we anticipate in 2024, when we hit in the spring to the Worcester public school systems, we'll see about 1,800 students in grade 5. This fall, as you were talking, we were testing the tires, so to speak. We are anticipating hitting about 1,500 students by the end of year. So I really think it's wonderful that we're able to get into the school systems and be able to share this Safety Quest program and really help the students become educated and aware of how important it is, not just around pedestrian safety, bike safety, but in the home. What do they need to be aware of while they're in the home or on the playground?
Right. So important. And I'll tell you a little secret. One of the things that thrilled me the most about the plans MAPFRE has for the vehicle is that you're building a carport for it, a big carport, because that winter damage that we got in 2018 that essentially ended the run of Mola Safety Street which was really a result of we didn't ever have a place to garage it in the winter, and one particular storm just killed us. So this was good news for me when I realized that you were going to have it housed in a protected area, which is wonderful. Your headquarters is in Webster, but what do you consider your catchment area for MAPFRE as far as your penetrance into the insurance world? And
in the United States, our largest market is Massachusetts, so a lot of our time and energy and resources go into the Massachusetts marketplace. But we're in 14 states, as far west as California and Washington and Idaho and Oregon, some states in the central Ohio, and so we're spread pretty well across the country, and the foundation supports programs in all of those states. But again, Massachusetts is our home state. That's where we're domiciled, and that's where a lot of our time and energy is spent. And I can assure you the RV is really well protected. I saw it this morning in its carport. In fact, Dominic was pulling out of the parking lot as I was pulling in, I'm sure on his way to one of the local schools.
Yes.
It's great to know. Well, the reason I asked that in part was we're part of a coalition of injury prevention centers called the Injury Free Coalition for Kids that was founded back in 1994 through a grant of the Robert Wood Johnson Foundation. Now, the Robert Wood Johnson Foundation very generously kept its support going for 15 years, but in 2009, they kind of said, now you've got to stand up on your own. So all of the centers, and there's 46 of them now, are self-sufficient. And we in Worcester, we were the 15th clone of the original program, which was based in Harlem in New York City. But the whole premise of that is you see a best practice in any one of these 46 centers and you try to duplicate it. So it was nice to hear that potentially there's 14 other states that might be able to approach you and say, hey, we want one of these things. And especially if we get the data to show that it's making a difference.
Sure.
Yes.
Because this has got to be looked at not as a proprietary thing, but as a spread the mustard seed kind of a thing. And that's really how we've always rolled out all our programs here in Massachusetts. So I think the other question I wanted to ask Linda is, you put together this incredible team of video specialists and educational specialists. How did you get the expertise to pull all this team together that put this these three stations really together and gamify all of these behaviors that we want?
It really, Dr. Hirsh, was a team effort in reaching out to various providers that we've worked with. The UMass, your team also offered some wonderful insights into the expertise that we need. We work with a partner called CTP Boston, who brought forth the video expertise and their expertise to be able to help guide us as a team on what would really work and resonate from an immersive interactive technology perspective, and then blending that with the UMass team and the experts as it relates to the injury prevention. And then the team, we met every week to be able to talk through and put all of those components together. We were like a well-oiled machine. It was really a team effort to be able to listen and understand everyone's perspective, and really working with the Worcester Public School systems as well. Always the focus was on what was best for the children and how do we get this information into the children's hands in such a way that they're excited about it and that they all walk off that Safety Quest RV and back into the classroom with the knowledge and understanding that they could take home information with them so that they feel safe and protected, and their families as well, because we encourage them to share the information with their families. So I would say it was really a team effort. I was really just the facilitator to help everybody really come out to really deliver an RV that's a state-of-the-art RV and an educational program on injury prevention that we hope, hopefully once we maybe get to the end of next year, we see the data, and we can hopefully see the success that we have in impacting the children here in Worcester and Central Massachusetts.
So I know this website is in development now as we speak, and it will be up and running, but if there are folks that are listening that say, "Why, I would really like to have this come to my school," how would that happen?
Yeah, so on the website, you'll see an email that says Asia Simpson at UMass Memorial Medical. You can send a request to her. Not only will we go to schools, but we're really excited that we'll be able to go to community events. And one of the first community events that the Safety Quest RV will go to is on the 22nd of October to the UMass Employee Family Day at Polar Park. And if there are community events that are happening, and you might have an interest in having the Safety Quest come, we are also excited to do that as well as to come to the schools.
That's great. So, Steve, from your perspective, is it the thought that with this kind of activity, you generate the kind of goodwill that makes people interested in safety?
Yeah, I think the Safety Quest van aligns perfectly with the foundation goals, and that is road safety, public safety, practicing safe behaviors. I think the age group that we've targeted, that 5th grade, 10 to 12 years old, I mean, that's the right time to teach these kids safe behaviors. They're probably more apt to learn and be willing to listen. And, I've gone through the modules myself. They're really well done. They're fun, particularly like the escape artist.
Yes.
We've seen an uptick in fires. You talked about more injuries since the pandemic. We've certainly seen that in auto crashes, but fires as well. So it's really important for kids to understand the hazards of fire and how to get out of a house if they run into such a thing. So,
Yeah, we have as our focus this year, National Injury Prevention Day is every year on November 18th, and this year burn prevention is one of our main ones. I haven't even talked to you about this yet, but we were talking about maybe having Safety Quest at some event that day. We're lighting up the Burns Bridge that connects Worcester to Shrewsbury green, and also City Hall will be green, and something on our UMass campus will also be green, which is the International Injury Prevention colors. So I just want to say thank you so much to MAPFRE, and thank you both for your dedication to the safety of children. I think our former city manager, Augustus, used to say children are 20% of our population, but 100% of our future. And I think that's a really great way to look at what Safety Quest is trying to do, is to keep them safe and to get rid of the most preventable type of injury that would otherwise be a deadly killer for them. So thank you both.
Thank you for having us, and we look forward to having a long-term partnership with UMass Memorial.
That's great.
absolutely. Thank you, Dr.
Thank
Hirsch.
you.
Pleasure to be here.
So this has been another very exciting, to me, episode of Health Matters, where once again, between the partners that we have here in central Massachusetts and around the world, we are able to make a positive impact on the health of our viewers and their children. So come back and see us another time. You'll see when we're on the air in the schedule that WCCA TV has in its on its channel 194. And thanks for listening. This is Mike Hirsh signing off. Thank you very much, Linda. Thank you very much, Steve.
Very welcome.
Thank you.